the clinic was founded in 1970, so 40 years ago, and by Dr. David Morris, who was a family practice doctor in West Salem, and found in this region a lot of people that had issues with allergies. And he started treating them in West Salem and decided to make that a full-time specialty of his. And so he moved to La Crosse, formed Allergy Associates of La Crosse, and for the last 40 years has been delivering allergy care for the whole region here in La Crosse. And we recently moved to our new location here in Onalaska. Well, philosophically, our approach has been to have the most extensive diagnostic and treatment approach available for allergy sufferers. And we do that in a couple different ways. On the diagnostic side, we have a full complement of all the different ways to determine how allergic somebody is. And then on the treatment side, we treat with the allergy drops, sublingual immunotherapy, which is different than allergy shots. What it allows us to do is to treat a much broader range of allergy sufferers. And that's really the unique thing that the clinic was founded on, was our ability to diagnose and treat the broadest range of allergy sufferers. And so we're able to treat not just hay fever, pollen allergies and things like that, but people with real severe allergies, mold allergies, food allergies, very young children, get them before they developed a lot of allergies and asthma and things like that. So we really have a unique proposition to offer an allergic person. We certainly have quite a number of referring physicians. Because we see patients from as far away, from all over the United States, our average patient travels 250 miles one way to be here. So we have a very wide referring physician group in terms of geography. But even here in La Crosse, throughout this entire area, I think about 350 referring physicians altogether. So we collaborate with those physicians to treat patients that we have in common. We also have done research with University of Wisconsin-La Crosse, UWL. We have done research with Viterbo University. We do some training with WTC in their medical assistance program. So we're reaching out and now to Globe University. I know they're going to be working with us as well on the medical assistance training. So we collaborate with those organizations. We put on some classes, some education programs where we'll use some of their facilities, although probably the biggest benefactors of our being here are the hotels and restaurants. Because patients come from a long ways away, we account for probably 2,500 to 3,000 overnight stays a year. We see about 12,000 patients throughout the course of the year. So that means a lot of economic activity in the area as well. A lot of overnight stays, restaurants, shopping. We even have many patients that say they make it an annual vacation to the La Crosse area. First stop being coming to see us, or maybe it's their last stop, I'm not sure. Well, our workforce, what's interesting about how we do things, because we're doing such thorough diagnostics, doing a lot while the patient's here, because they're coming so far, we have to do that. Many of them are cross-trained in different functions within the clinic so that they can step in wherever the need might be. When you're seeing 60 or 70 patients a day, you have to be very efficient. So we do cross-train, certainly on the clinical side of things, on the business office side as well. Everybody pitches in. They've been cross-trained in a variety of different areas. The La Crosse area, the 7Rivers region, is, I think, very stable in terms of its economic base. the number of healthcare entities that are in La Crosse in particular, but throughout the region. It's a regional focus then for healthcare. I think the educational institutions here is a real asset. Great source labor pool, well educated, well prepared. So those two things I think really kind of lead the way, and economically I think we're pretty stable. We don't see the big swings one way or the other. We kind of are able to all thrive in a pretty consistent way.